And do you see digital tools playing a role in educating physicians?
Definitely, because it will be time saving for the doctors as well if they can refer to any type of digital tool or site where patients can find qualified and certified information that is matching the information that they can find in guidelines, and information that is matching also the information that they receive by the treating physicians and all those involved in the care pathways.
Dr. Usmani, I see you nod.
Yes, I mean, I like the term transformation, and it is a transformation, it is a culture change, and it's a change in the way that we practice. And I think digital could be the cement that actually brings the patient's concerns together with the physician's concerns, as well as an umbrella of education. And that isn't education that is just there and you tap into it, but that's tailored, it's personalized to the patient. So you often, so what digital allows us to do is, in normal practice, we see a patient or a patient sees a doctor. It's a static moment in time, but we're unaware, as you said, Professor Bousquet, Jörn, of what happens in the real life environment. And here, what the digital technology will allow us to do is actually understand the patient's real life over the course of a couple of months before they come back and see us, and get an idea of exactly what's happening. And just prior to the filming, we were talking about human behavior and behavioral psychology, and how I think that's a really important component, not as a stick, but as a mechanism to actually understand what is going on. What is going on with the patient? How should we, you said we learn and then we practice, but we need to understand what the patient does. And all of these components, digital will allow us to understand. So just recently, last week at the ERS in Paris, we have our first test campaign in My Air Coach, where we assessed 100 patients with asthma over 4 weeks. They were, this was a test campaign, so they were having their asthma monitored through wearable sensors. So they had breathing equipment looking at their peak flow, nitric oxide, as well as they were filling in questionnaires, and we were assessing their use of inhaler. And what we found was that there were different patterns emerging from those that had high inflammation in the airways and the relationship to their treatment. And you would expect that some of those might have high levels of inhaled corticosteroid use, but some didn't, related to those that were able to exercise. So the key aspect here is the digital system may allow the patient's concerns, the physician's prescribing, and the information to be integrated in a manner that's tailored to the patient, and it should certainly progress along those lines.
Dr. Bousquet, you talked about digital transformation. I have a question for you. Is our medical education already adopting this?
No. Frankly speaking, education has been a disaster, because we have tried to educate asthmatic patients for the past 40 years, but the number of canisters of inhaled corticosteroids has not increased. So we have tried to do education, but we have done education from a physician perspective, and we need to do education from a holistic perspective. What I would like to say is that we have two tools. One is the best developed tool with everything in it. And ours, like my rhinosynist coach, is simple, 4 questions. So I think that we need to come together and see what our experience is, and then bring to something in between. Because we have two things which are totally complementary, and we need to know better in order to transform. And there are at least 3 EU grants this fall on transformation. One is transformation of healthcare system for the payers. The second is called Digital Health Europe, is how digital health is going to transform healthcare. And the third one is on procurement. And I think that you should come with us on this, because we are part of them, and we may bring something more important, because there are an enormous amount of tools today. Very, very few are tested, by the way. You find 100 apps on rhinitis, there are 2 which are tested. The same in asthma. So the people who have tested the solutions should come together make a group possibly on behalf of EUFOREA, and then try to understand what we have learned, because we are learning a lot from these apps, and we are learning for the patient. And this is the way. And then we need to have patients with us, because they're going to tell us, hey guys, this is completely wrong. Well, we want this. And this is exactly what we need. A group of people with tested apps joining forces, not necessarily on behalf of a big organization, but on behalf of EUFOREA, with patients. And then we're going to learn to understand, because, you know, it's new way. I tell you, internet has changed our lives. Digital health is going to change the lives of the doctors. But we are 20 years behind.